Beginning with the chest complex around the pectoralis major muscles, you're going to place your band at the front of the shoulder. This is the AC joint, and this will help you to keep that AC joint from moving forward. Oftentimes we'll see compression through this area. As you inhale, you reach a little across the body, then on the exhale is the stretch where you take the arm back. As you exhale, do feel the shoulder blade muscles squeezing back. Those are the rhomboids, and that should give you a good stretch. Notice the hand keeping the rib cage pulled down. That way you're avoiding the compensation of puffing the ribs in the front. Work with the hand at different heights. You want to go shoulder height, above shoulder height, and lower than shoulder height. This is going to give you a good variety of movement through that fan-shaped pectoralis muscle. Remember, inhaling to neutral, exhale to stretch. Switching for the other side, you're going to place the band around the front of the shoulder, and then you'll begin to work. We're collecting about 10 repetitions here. Of course, you can always spend more time on an area that feels especially tight. Think of this as a strength training regimen that you're collecting sets and repetitions. Inhaling to the neutral position, then exhale through the stretch. Continue breathing throughout the duration of the movement. You're holding for 2 seconds and release. Inhale, exhale for 1, 2, and release. Continue working through the movement, feeling that contraction through the shoulder. Moving into the anterior shoulder now, we're going to stretch the arm straight back. As you're doing this, think of leading with the small finger side of the hand. Keep the arm near to the body and keep the arm internally rotated. So the small finger leads all the way back, almost like you're karate chopping the hand. As you inhale, release to neutral. Exhale, feel the back of the arm engage, and that's going to pull the arm back into that shoulder extension position. The band is going to keep the shoulder engaged. It's going to prevent the compensation. Switching sides. Setting the band at the front of the shoulder joint, and then as you exhale, you're going to take the arm straight back. Inhale, just release, let it swing forward, and then exhale, moving through the extension. Imagine you can increase the range of motion by just a few centimeters with each rep. Inhale neutral and exhale through the stretch. Can you feel the stretch along the front of the shoulder, the anterior deltoid, and then as you chop the hand, the bicep? Moving into the rotator cuff, we're going to stretch the internal rotators. Hold the hand out just lower than shoulder level. Inhale neutral, and then as you exhale, focus on rotating the upper arm bone back or externally rotating the humerus. Here the band does a great job of keeping the shoulder locked into place. Oftentimes we'll see compensation in this movement where the shoulder blade will rise up. So the band here is really helping you to keep that shoulder stable, and you're rotating the upper arm bone back. Inhale and exhale. Just switching sides here, so the hand is out a little lower than shoulder height, and then you bend the elbow by 90 degrees. The weight of the forearm should give you some feedback when you're moving through the external rotation. Again, the focus is on the upper arm bone. The hand is really just passively moving through this range. You could hold a light weight here. Sometimes that's very useful for giving you that feeling of engaging the shoulder blade muscles, the external rotators, that stretches the internal rotators. Now moving into internal rotation, which stretches external rotator cuff. Same position, we want the elbow a little lower than shoulder height, and then as you exhale, you're going to internally rotate the arm. This one is usually challenging. You're going to feel the chest muscles engage, the armpit muscles engage, and you'll feel the stretch along the back of the shoulder blade, the supraspinatus, the infraspinatus muscle. The second part of this, you place the hand behind the back in the bully stretch, and now we're going to start to work into some of the anterior and lateral portions of the neck. Inhale, and then on the exhale, you're just going to stretch the head back and over the shoulder. You can feel that large neck muscle, the sternocleidomastoid, the scalenes, and other throat flexors. Changing sides, we place the right arm into the band now, and we're going to internally rotate. Notice that the rib cage stays pulled in. In fact, you'll notice if you really keep your abdominals firmly engaged, you're getting a much greater internal rotation. One of the big mistakes we see is that people are loose through the spine, and then the internal rotation is not as significant because there's a tendency to compensate and move the entire chest, shoulder, and body. So keeping the self straight as you exhale, rotate. Go ahead and move into the second phase here, that bully stretch. We're going to place the hand behind the back, and then we start to work into the side of the neck, the throat, and all kinds of tissues here, including the subclavius and muscles that are deep to the chest and front of the shoulder. Inhale to neutral, and then exhale, pull through your stretch. We're going to work on a PNF stretch here of the armpit. So the band will pull the arm out of the socket, and then your job is to contract the shoulder and pull the arm in. You're essentially protracting and retracting the shoulder. So as you inhale, you're going to retract, pull that shoulder in, then exhale, let the arm stretch out. You're going to feel this in the armpit muscle, the subscapularis. The second part of this stretch is taking the arm overhead. This is going to work into the tricep and the lats. Use that same PNF or resistance stretching. So when you inhale, you're going to pull the elbow forward. In the exhale, you'll let the arm stretch back with the assistance of the band. As you're doing this movement, keep the elbow close to the head. You'll challenge your range of motion more that way. Keeping the ribs pulled in so you avoid the extension of the spine, focusing on the shoulder itself. The second side. So we've got the band around the back of the hand, and then we're going to work on retracting, pulling the shoulder blade into the body, and then as you exhale, let the band pull the arm out so you get that long distraction of the arm bone. Feel free to hold this in a static position. You can move further away with the band, and that way you get more of that deep static stretch in the armpit muscle. This is an especially good one if you find yourself becoming very short in the arms, like little Tyrannosaurus arms. The second part, the overhead arm position. So we have the elbow bended and close to the head, contracting the elbow forward, feeling the engagement through the underside of the shoulder. That's your lats and serratus muscles. And then in the exhale, you can feel that nice stretch and mobilization back. The PNF technique is quite effective because you're facilitating the muscles to release. You are contracting, they become fatigued, and then when you exhale and relax, they naturally stretch and move back. Continue working with your breath and spend about 10 repetitions here. Moving into the lats complex. This is really a fantastic stretch. The setup can be a little unusual at first. You want to move laterally away from the band, and then you hinge forward about halfway. Knees a little bended, and then you're going to retract and pull the shoulder blade back. And then in the exhale, you're going to let the arm stretch across the body. So you're going to have a thoracic rotation, as well as that deep stretch along the back muscles. And this is fantastic if you ever feel that tension between the shoulder blades. That is so common. Sometimes from trying to maintain good posture, we keep the shoulder blades pinned back, which causes more tightness along the back muscles. So here we can really gain that sense of width across the back. Inhale, contract, pull the arm back. Exhale, stretching across the body. Inhaling and exhale for about 2 seconds on the stretch. Switching sides now, we're going to do the same action where we contract. Here you can really see how the shoulder blade is going to pull back toward the midline, and then as you exhale, you're going to feel the shoulder blade stretching wide on the back. Try doing this with the action in the shoulder itself. The tendency is to bend the elbow, which we're flexing the arm at that point, which is not exactly the target here. So we want to feel the contraction of the shoulder blade muscle moving back toward the spine. And then when you exhale and stretch, you're going to feel that movement away from the spine. So you get that nice width across the back of the body. Always work at different angles so you can explore new tissues and territories along the back. Now moving into an unusual stretch in which we're going to move the arm through extension and then we'll move it behind the back with internal rotation. This is a movement that if you're doing a yoga class you might find in which you're wrapping and binding the arm behind the back. So when you inhale, you're going to try to pull the shoulder forward, thus squeezing the chest muscles. And then when you exhale, you're going to allow the arm to stretch with the assistance of the band. The PNF technique is very effective for building both a strengthening of the specific muscles that you're targeting, as well as a specific stretch or mobility. Switching sides. So we internally rotate the arm, we move the arm behind the back, and here we can really feel the pec minor, the deep subclavius muscle, and other tissues associated with the front of the shoulder. As you inhale, you're contracting those tissues, you're going to feel the arm moving forward, the chest moving forward, and then as you exhale, you allow that rotation to occur. The arm is pulled behind the back with the assistance of the band. Keep working with your breath. You want to really coordinate movement and breath here. Inhale, contract, squeeze. Exhale, relax, and let it move back and through. Some passive technique is okay, but you're going to find much more benefit when you're using active and resistance techniques. Distracting the elbow now. So we're going to bend the elbow around the band, and then you're going to simply flex the arm here. The elbow is going to be pulled by the band, so you should feel this as an armpit stretch, and then you're just distracting or creating a flexion gap in the elbow. So you squeeze the bicep muscles, the elbow flexors, and then you let it go in the exhale, inhaling and exhaling. Now place the elbow or the hand behind the back, and now we're going to feel a passive stretch of the armpit muscle. Notice that I inhale and squeeze the arm into the body, and then exhale, I let it stretch back out. So we're continuing to improve that internal rotation of the shoulder. Switching side, we distract the elbow first here, so we flex the elbow around the band, and then you're going to let it stretch. If the band is feeling that it's too intense on your skin, you can wrap a small towel around the band or around the joint itself. That way the band is not pulling so much on the skin. So here in the second phase, we place the hand behind the back in the bully position, and you can really feel that width as the elbow, the arm is being pulled out of the joint, and you can feel the stretch through the armpit muscle. As I mentioned, the shoulder blade tends to be really stiff through internal rotation, so it's really helpful to spend time in this action. Improving internal rotation will also improve external rotation, which improves overall stability and movement capacity in the arm. We'll finish up with some lat stretching here. So we're hinging forward in order to take the arms overhead. If you have a high position, you can tie your band up high, and that will make it a little easier for you. So we're using that PNF technique in which we're contracting, we're pulling back, and then in the exhale, we're allowing the arms to stretch up and overhead. As you inhale, you want to squeeze through the midsection, the glutes. In the exhale, you allow the arm to stretch up and overhead. Always spending about 10 minutes throughout your shoulder sequence.